I don't think there's anything that's certain in the world at the moment. There's a lot that can change, there's a lot that can happen. And I think that is in the back of your mind every time I'm going into work.
Adult trauma, ETA 5 minutes.
Got an assault coming in. He's stabbed multiple times.
5-year-old hit by a car, dragged for 3 metres, degloved the right side of their scalp. Code red.
They're now saying partial amputation with a traumatic cardiac arrest.
This is just disastrous.
Travel by cow. I can't make that up.
Oh, it's a proper day today, isn't it?
St George's, London, one of Britain's busiest A&E departments, under more pressure than ever.
What are you doing?
It does sometimes feel like a battlefield, and it feels like a losing battle at times as well.
You need to calm yourself down.
I have 10 traumas and absolutely no space.
25-year-old jump from a 3rd floor balcony.
This is the point where we can make a difference.
Thank you, everybody. Thank you.
A place where life,
Best place to make friends. A&E.
love, and loss
Scariest thing in my life. I thought I lost it.
unfold every single day.
A life is not just a singular thing. Things that happen to you have a huge effect on the people around you as well.
You scare me so much, you know that?
All the patients you're about to see were treated in just one 24-hour period.
I see behaviour every day that reaffirms my belief in the inherent goodness of people.
It's all a bit of a shock, isn't it?
And I think I'm incredibly fortunate to work in that environment.
It's a lot to take in. He's the love of my life.
My husband, Tim, just loves the very outdoor life. When we moved to the UK, we moved to an area in Swinley Forest. He really then got very much into his mountain biking because there's loads of trails and it just goes on forever in there. The boys will go on their mountain bikes with Tim into the forest a lot. They find all new sorts of trails and quite big jumps. He really wanted to find something that they could do together. My eldest Matthew was bragging to Tim that he had done this jump. Being the child he is, Tim then thought, I'll have to do it now.
You okay, Dad?
St George's Recess, 43 male. Yeah, that's perfect. Thanks very much for that. Thanks, bye.
Tim's injuries are so serious that he's been transferred from his local A&E to the trauma centre at St George's.
Secondary transfer from Frimley.
Coming in tubed or just?
No, just chest drain in situ, it seems like. How long are they going to be?
About 10 minutes.
Most district general hospitals can treat some very, very sick people. So if they are not able to deal with it there, you've got to be mindful of the fact that the patient could be very complicated.
Tim's wife, Terry, is with him in the ambulance.
He just couldn't move, and he really was struggling to breathe. He just was in so much pain. He just looked terrible.
Have we cleared his spine? Do we know what? We just check what imaging has he had from there?
He's CT head to pelvis. Okay.
Yeah, I'm at the bottom.
This is Tim. Tim was on a mountain bike, went over a jump, lost his balance, went over the handlebars at about 20 miles an hour, was wearing a helmet. He's had CT head to pelvis, which have shown a fractured fourth rib with a left-sided pneumothorax, fractured T11, T12 and L1 with no neurodeficit. He's also got a hematoma on the left ear and a fractured right little finger. He has got a chest drain in situ. He's had 12.5 milligrams of morphine combined, and that's it.
Hello. I'm Manny. I'm the consultant here. Yeah. Your lower back, I know. I want to look at the imaging myself, so I want you to keep lying flat until I let you know. But we'll get you sorted. Good.
Try and keep your head as still as possible throughout all of this, OK? Chest drain in situ. And can you open your eyes for me? GCS is 14, -1 just for the eyes.
With a mountain bike accident, you know the potential for injury could be really severe. Head injuries, spinal injuries, neck injuries if you've gone over your handlebar.
I've got end plate fracture there.
I mean, whenever you're suspecting a fracture of the spine, if these fractures are serious and have impacted the spinal cord, the patient could be paralysed, effectively from the waist down.
The CT report was your chest, fourth rib fracture. From the spine point of view, we know you've broken about 3 bones there. Your 11th thoracic vertebrae and your 12th thoracic vertebrae and your first lumbar vertebrae, so 3 vertebrae in a line. There's a superior end plate fracture of T11. There are probably also minor depression fractures through the end plates of T12 and L1. Basically means you've probably bent like this, and the compression has caused the front bits of the bone to kind of fracture. They've gone like that. So as soon as we get the answer from our neurosurgeons with regards to what they want us to do with regards to the spine, we will let you know. And then the other bits and bobs, the other injuries, we will sort out in due course. You've broken a rib and collapsed a lung, so yeah, it's not going to be comfortable.
My blood ran cold. I think when you hear vertebrae and spinal damage, then you do worry that something life-changing could occur. For me, Tim's always been quite invincible, I suppose.
Oh God, it's queuing out the door now, Joan.
Is this a day off for you today?
It is. I'm quite lucky. I'm a GP.
Ah.
So we leave all the work to you on bank holidays.
Who can we take out? Who's stable to leave out? 4 stable. Move 4 too. Yeah.
My wife always commented that I'm old before my time. I'm kind of like a grumpy old man already.
Oh, man. Still got so many patients to see next door.
There are things that tend to vex me, which shouldn't really vex me. For example, putting the clothes out on the rack after they've been washed. I have a way of doing things. The bottom rung is for socks and underwear, the middle rung is for T-shirts, the top rung is for trousers.
At the moment, I have 10 traumas in resus.
Adult medical priority, 10 minutes.
Got a space? No!
We are treating more and more elderly patients. The population is getting older.
90 female.
It's that simple.
It's getting ridiculous at the moment.
The NHS is stretched more and more.
Yeah.
We're getting shafted right now in here.
I don't see an easy way of dealing with increased demand without increasing the resources to cope with that demand.
Jelly in your tummy, OK? Sorry. Yeah, there's got an aneurysm.
I quite enjoy looking after elderly people. I feel as you get older, you are worthy of more respect. And that's how I was brought up.
And in the services, I did a lot of boxing.
Who were you with?
Air Force.
These people are full of life experiences. They're the reason we're here today.
Let's get him round to X-ray. Thank you. Hi, guys.
Okay, so this is Mary, but likes to be known as Molly. She was going to rape trace today with her daughter.
91-year-old Molly has been brought to A&E after her daughter Susan accidentally drove into a lamppost whilst parking the car.
Her daughter's outside.
I drove into Waitrose car park and I saw a lovely clear space, and then disaster. struck.
Pain score 6 out of 10. She said she does feel very anxious and worried.
Don't really know what happened, but instead of putting my foot on the brake, I put my foot flat down on the accelerator. It ended up us going up the curb, hitting a lamppost, and then we bounced back as if nothing had happened. It was quite a shock and quite a jolt.
Molly's passenger wearing a seatbelt. Initially, Molly was complaining of sort of central sternum pain. We got her on the ambulance doing some observations. Chest is absolutely clear. It's just this irregular heartbeat.
And there's more of a medical call because of the fast AF type thing.
She had a little bit of a sore chest. I rang an ambulance. There was no obvious broken bones, but they were concerned about a rapid heartbeat. You feel guilty if it was someone you didn't know, let alone your own mother, who's 91.
Hello, Mary. Molly, I beg your pardon. My name's Manny. So the main reason you were brought in here was because your heart rate was really fast. Then let's get you on some monitors and things.
Yes.
I'm going to examine you. I just want you to raise your right leg up and bend it.
Oh, raise my right leg.
Bend it.
Oh.
And bend it.
Oh, gosh, I've got cramp.
Sorry, and straighten it. Well done, you. This side. Yeah, and straighten it again. Well done. Pretty sprightly. Hello.
We got it.
Got 2 men after you.
All right, yes.
Come on in.
You look quite well, Mum. You look very bright, doesn't she? She was always very fashion conscious. She used to love wearing high heels, nipped-in waist. She always looked well turned out.
Your daughter-in-law, I think it's daughter-in-law. You don't want
she
her
can
in?
come in,
Yeah,
yes.
OK, I'll bring her through.
Shoulders here.
Oh, hello, Shoulder.
How are you doing, honey? This wasn't the bank holiday you were expecting. Oh, dear. You seem quite bright in yourself now.
Well, yes.
Relaxed a bit. And we had a policeman in, didn't we?
A nice-looking young policeman, I thought.
I see her as a little bit of a flirt. A twinkle in her eye, shall I say. When Mum and Dad were going out and Mum's dressed up, you could see my dad was proud of her and Mum would look up at Dad. They were married for 65 years. They had an understanding, and you could just see it. My dad was her life.
So we're going to get her sorted. We're going to get an X-ray of your chest. The injury I'm not so worried about. It's more your heart rate, which we'll look at as well, because at the moment it's dangerously fast. I'll come back to you guys in a bit.
Okay.
Hi there, it's Dan, one of the A&E SHOs. I have a trauma call that's come in. So he's actually a trauma transfer, so originally went to Frimley and has been transferred over here. He was cycling and went straight over the handlebars.
43-year-old Tim is being treated for multiple broken bones and a collapsed lung following a mountain bike accident.
Got T11, T12 and L1 vertebral fractures.
Doctors are referring him to neurosurgeons to assess 3 fractures in his spine.
Anywhere along the spine, you can have a significant fracture that makes the spine unstable. The worst case scenario with an unstable fracture vertebrae is that there is a movement off the spine in a way it's not designed to move. The spinal cord gets injured, and then the patient is paralyzed permanently.
So, can he have a bit of water now or not? He's really struggling.
Yes.
So dry.
Yeah.
So we met in Cape Town, South Africa. It was only on holiday, so it was never meant to be anything, you know, I suppose more than a holiday fling. Very good friend of mine said, oh, you must meet Tim, you'd get on so well. Thank you, I think that straw is going to be easier. Thank you, thank you. We just got on, we just kind of clicked. We went to lots of bars and out to the beach. We used to just sit on the beach and watch the sunset. I thought he was very cute and good looking. He was a lovely guy. I felt like I'd always known him. We just felt like a puzzle piece, I suppose. We just felt like we really were put on this planet to be together.
My name's Aileen, I'm one of the radiographers, and we want to see how that drain is doing, okay?
As we're getting older, the thing that I completely love and admire is the father he is to our 4 children. They all adore him. He just gives whatever spare second of time he has.
X-ray bed forward. Okay, I'll let you know.
To lose him as the father he is, it would be devastating.
Oh, hello. It's not a good day.
It's not a good day. It's day. Day.
Just day. Are you booking in? Yeah.
It must have just been mad.
It's been horrendous.
How long have you been here?
No, we've been here an hour.
Hello, St George's. Medical trauma.
An 83-year-old woman is being rushed to hospital, struggling to breathe.
Yep. Cheers, bye. Priority 12 minutes.
When an elderly person has real problems breathing, there could be many, many reasons for it. Have they got something like a lung collapse? Have they got an infection? Have they got fluid on the chest? You have to make a quick assessment. You can't breathe, you can't survive. It's really serious.
The woman's husband, Leslie, is with her in the ambulance.
She was sitting on a chair in the bedroom. Her breathing was terrible. It's just that I didn't know what to do. So I rang the 999. Well, she keeps saying, I'm dying, I'm dying, I'm dying. I just said, you're talking stupid, because I don't want to die.
Into 5, please. This way.
She panicked. And she wasn't with us.
I know you're tired, you're exhausted. Just bear with us just 2 more minutes.
She's calling for her mum.
1, 2, 3. No, sorry. Yeah.
She was in a bad state. It's frightening.
Janette, 83.
She's asthmatic. She's had a cough for a month. Last few days it's been getting worse and worse. Last night she was just up coughing all night. Normally quite well. It's only the asthma that she's got. Other than that, she's very well. She took just a couple of steps and then she just completely deteriorated downhill.
As you can see, she's working really hard at the moment.
All right, nice and easy. She's really working. Equal entry on both sides, but she's definitely got a bad wheeze. It looks like she's really tiring out. I think she's accumulating carbon dioxide right now. She's not doing good.
You know, one of the big problems when you have a breathing problem is that you may not be able to exhale carbon dioxide. As carbon dioxide builds up in your bloodstream, you tend to get more drowsy. And as you get more drowsy, your breathing gets impacted and gets worse. So you get into this vicious cycle.
Just put this arm straight for me. Nice and... I'm going to take some bloods, OK?
It can be very, very serious. As serious as a lack of oxygen. Ultimately, you will fall into a coma and die.
Could you run this for me, please? Arterial on 8 liters.
Yeah,
husband's in relative.
Okay, fine. We'll bring him in a few minutes, okay?
It's frightening that you're in a position like that and you cannot do anything. It did upset me. It did enter me that this is the end, like, you know.
I'm going to save this phone battery for a song when I'm in the car.
Don't tell me it's Justin Bieber.
What? I don't listen to that music.
Justin Bieber.
I listen to gang music, Mum, basically.
The square root of that. I've done it. I've just got it right. Oh, yeah.
Yeah. Oh, I can't do it. Tyler's trying to teach me.
Hold those two tight, let that one go floppy. It's because you're not bad, man.
Too early to bring our husband in.
Oh no, you can bring a husband in, that's all right. There we go.
Doctors are giving Janette emergency oxygen after she was brought in struggling to breathe.
Do you want to come in, darling?
Yeah.
She's really quite poorly at the moment.
Is she?
All right. I think she'll respond better to you being with her.
Yeah.
Her husband Leslie is with her.
You just hold her hand, I'll find you a chair, okay?
Thank you. Okay, you should be doing all right. So you've been married 62 years. 62 happy years.
You can speak, yeah.
What do you say?
Yeah.
Oh, you've been here. Because an hour. Had her ups and downs. And they said he should never go to bed on an argument. You should make up. We didn't. We used to argue. We go to bed. When we wake up in the morning, now where were we last night? What was you arguing about last night? we carry on again. But we always make up.
Hi. Just want to update you. This is what we think is happening right now. We think she's got a really bad chest infection that's acting up.
Yes.
And that's the reason why she's had the difficulty in breathing. Give her some medication through the IV line to help her breathe better.
Yes.
And we'll give her the antibiotics and everything and see how she improves with that. We'll do a quick chest x-ray. And as soon as I have more information, I'll come back to you.
Okay, thank you.
Sure.
Thanks very much.
Sure.
Try and go to sleep if you can. Relax. I was in the TA. We have a spring ball every year. When I turned up, I walked into the bar and all I could see was a bum leaning over the counter to Janette. That's the first thing I fell for. I always tell her that. I fell for a lovely bum. We had a few dances. And that's how it started. Oh, she was lovely, pretty. She'd get on with anybody. Oh, still around, fella.
Yeah, we're just about to go. Don't talk. You just focus on your breathing. It was lovely to meet you. I'm sorry it was under these circumstances. Okay? You did really well in the back of the ambulance. I could see how scared you were. You did really well, okay? Good on you.
Wish you well, fella. Might you go now? We've had two lovely children. She's a wonderful mother. I love every bit of her. Nice and warm. Nice and warm. She's my wife. And I picked the best one that you wish to have. Try and shut your eyes then, Pat. And try and go to sleep if you can. You're in good hands now.
That means it's gone. How's that done that? It's in, it's swinging. It's doing the job. His lung has expanded. We'll leave it for now.
Doctors are treating Tim for a broken spine and a collapsed lung following a mountain bike accident. While neurosurgeons review scans of his broken vertebrae, a specialist nurse has been called to treat an injury to his ear.
Timothy.
Yes,
Hello,
yes.
my name is Christy. I'm from E&E.
Yes.
To come and have a look at your ear.
Yes.
Probably you can't see, but there is a big hematoma in your ear, which needs draining. So when did you move to England then afterwards?
About 10 years ago.
10 years ago.
Yeah. My grandmother's from England.
We both grew up in the 80s, the height then of apartheid.
2 injections.
Yep. Probably be ejection 11 or 12 today.
Everything was segregated. Black people were not allowed on the beaches, used to have to sit at the back of the bus. They had to have a pass, curfews. As a child, you didn't know any different. You brought up to believe white people were superior. Black people were violent. They would, come and kill our children. But we were very, very brainwashed into believing Nelson Mandela was a terrorist.
Do you want to sit down?
I might have to go.
Could be some blood.
Just remember, I was about 14 when he was released from prison. After that had happened, you all of a sudden got all these documentaries about apartheid, but from an international point of view. Pretty soon after that, I think it all started to become very, very clear to me. The treatment and the conditions that Black people had to live under, it was all incredibly barbaric. So then when Mandela was made president, there was this great feeling of joy and hope. And you just thought, what an amazing man. No bitterness, just with wanting to unify South Africa.
That's your hematoma, Tim. Open it up.
Wow.
Okay.
It looks a lot better now.
Yeah, it looks like a proper ear.
Yeah, I was just about to say that.
Thank you.
It looks more ear-shaped.
Very nice.
It's just very sad that today South Africa is very turbulent. You wonder, had Mandela been released 10 years earlier, would South Africa be different today?
It's done now.
Thank you very much.
We loved our life in Cape Town, but it's no longer just about you, it's about your kids and about their future. We felt that it was the best for them to move to the UK. Sometimes I think perhaps the British people don't appreciate everything they've got. It's a very inclusive society, and we were very, very welcomed and never ever made to feel, what are you doing here? Go back home. For our kids, they've just got the world at their feet. I think to be British means the world is their oyster.
Hello, how's your pain? Bearable at the moment.
So now we're just waiting for the
Neurosurgeons, just for them to tell us how they want to manage the spinal injury. As soon as I get the answer, we will let you know.
Do you know where the injection's going to be? Is it going to be like right next to the cart?
Yeah.
That's going to hurt like a bitch.
George. Hello.
Boring.
Shit,
5, 4, 3, 2, 1. Guess what? There's no more pain.
Shit, yeah, there is, man.
You're going into a different bay, Mum.
Molly is being transferred to Majors while she waits for a doctor to assess her fast heart rate.
Right. Oops. That's what happened with the car. Thank you very much. Thank you.
Hello.
Hello.
I'm Sarah. I'm one of the doctors. Now, how are you feeling at the minute?
Well, I just feel the same as I did this morning.
You've got no chest pain?
No, I wouldn't call it chest pain.
And you're normally very healthy, fit and well?
Yes, I think, yes. I think I'm out gardening and all
Oh, you
sorts
sound
of
good
things.
to me.
Yes. Oh, I can lose myself in that garden. When I'm a bit down, I go out and do all sorts.
And you don't feel your heart going fast?
I don't feel my heart at all. I thought I'd lost it.
What do you think was the happiest time in your life?
Well, I think when I've had my own home and had my children and had my Brian, my husband. It'll be 2 years this November. He died.
Nice big breath.
He went up to study and he fell onto the landing. He'd a massive heart attack. And I was there just in a second, but I couldn't do a thing. I just said, Brian, don't leave me. And I rang the ambulance straight away. They worked on him for 3/4 of an hour. Just couldn't revive him.
And no pain in your hips?
No, no. If I'm gardening, sometimes I get a pain in it.
Okay.
Everything I do reminds me of Brad. In the summer, he used to get us a glass of wine, and then we'd go out and sit in the garden. And that was just really very nice. He did, in a way, spoil me. It's not all husbands bring flowers every week. I don't think. He was my life.
Okay, that's fine. Your heart's still going a little fast, my lovely.
Yes.
It puts you a little bit increased risk of having a stroke.
Yes.
So we need to talk to you about whether or not we need to thin your blood a bit.
She's definitely staying in.
I think so.
Yeah.
Can't go home with the heart that fast.
No.
All right.
Yes.
But we'll look after you.
Don't worry.
All right.
I miss him just being here for me. There can be lots of people around, but he's not there. I'm still lonely. I don't think it's anything great getting old, but one has to go on.
Well, Graham, where's your son? Long good. Son. There she is.
Janette's son, Graham, has arrived to be at her bedside.
Hi, I'd like to refer a patient, please. This is Janette, 82 years of age, comes with history of asthma, recent history of chest infection. She's fairly independent. She mobilizes by herself. So this is quite a deterioration.
See, that's the cough. Yeah. And it sounds really bad. She changed my life completely after the war. I got called up when I was 18. And I was a gunner, Royal Artillery.
I'm going to give you an antibiotic now, OK?
We went right through France, Belgium, Holland, and then into Germany. You got used to it eventually. The explosions and bombs and that become a part of you. You're scared. Yeah, somebody got killed. They come into your mind. Are you going to be next? 18, 19, you know, it's young, isn't it? Really, when you go and fight a war. Hello.
Is this Janette?
Yes.
Your husband?
Yep.
What's your name?
Leslie?
Leslie, nice to meet you.
You too, Pat.
Hello.
Hello.
My name's Pascal, I'm one of the doctors. I'm going to have a listen to your chest, if that's okay. Do you think I could listen at the back? Well done. Brilliant, thank you. Okay. All right, rest yourself back. Well done. A little bit wheezy and rattly. So the problem that she has is called COPD. Has anyone said that to you before?
No,
It's like asthma, but the changes in asthma are reversible. In COPD, that's not the case.
COPD is chronic obstructive pulmonary disease. It's a more modern term for the old names for emphysema and bronchitis. You can treat the symptoms of it, but it's not something that's ultimately curable.
It just means that her chest is very vulnerable to infection, and she needs the nebulizers and the oxygen to get over that each time.
Your lungs don't have the same capacity and the same function as they did. It's something that will put an 80-year-old into hospital and may well lead them to not ever coming out again.
It's a shame that she couldn't have oxygen at home.
We certainly would never give this level of oxygen at home, ever. Essentially, if we didn't do this with high levels of oxygen, she wouldn't be able to survive. So I will come back a bit later because we need to do another blood test from the artery.
Thank you. Thank you. After the war, I remember going home and used to go around this big warehouse. You get a free suit, free Mac, free boots, free socks, free everything. But when I got home, all your mates had disappeared.
Just going to do your temperature. You always lived in London?
Oh, yeah, I'm a London man, yeah. Some had been killed. Their family might have been bombed. I was lonely, like, you know, miserable, really. Until eventually I met Janette. She looked after me. She made me feel that I was somebody.
I'm getting on with you.
When you're a bit better than what you are now, you're breathing. Once I got your breathing back to normal, then we'd be going home. She's my life. She is. Without her, just fall to bits.
Tell me your best joke. Right, a panda walks into a bar, orders some food, eats it, shoots the ceiling, and walks out. The guy at the bar kind of turns to the barman and he's like, bloody hell, that was weird. Like, why did you do that? The barman's like, did you not know? Pandas eat, shoots, and leaves. Oh my God, it's the way that you tell the jokes. They're so bad.
Oh, I get it. Eats, shoots, and leaves.
Oh, darling, sharp's crack.
A specialist consultant has now been called in to assess Janette.
Hello. We'll try and get you up to Marnham ward, which is our chest ward, the lung ward. All right. See how you get on. All right. If things get worse, often the next step is to put a tube and actually ventilate people with with an artificial ventilating machine.
To be put on a ventilator, that means a tube in the throat, it means sedation and paralysis, it means being in intensive care. It is very much last resort.
If it's going to be a long, protracted thing, then actually chances are your lungs aren't going to recover. But as I say, I'm hoping we don't get to that point, and that we can get you better just with simple oxygen. All right?
Yeah. Anything happened to Janette, I'd be lost. I want to go with her. Seriously, seriously.
But I'll go right today. No. You have to hang out with me for a bit longer.
Because otherwise there's nothing here for me. Nothing.
I'm gonna go to Richmond now.
Nowadays, people are living longer. As you get older, you have more problems that need emergency care.
So this one's gone, has it?
3.5.
That one's gone, hasn't it? Good.
It does make you think, well, what's going to happen when I get old? Because if we carry on increasing at the rate that we are increasing and with the resources that we have, we're not going to be providing the care that patients deserve. And I think that's the saddest thing about it all.
This is Tim.
Hello.
Tim this morning was riding his bicycle off-road and fell over a jump.
Emergency doctors are waiting for neurosurgeons to determine the full extent of the injuries to Tim's spine.
So how did it happen?
It was a little jump.
Did you do that sort of thing a lot, or?
Yeah, so that's not the first time.
My son had done it yesterday. They came home all excited, and so he had to go do
it too. So you're just a big boy.
He doesn't want to grow up, just a big kid, really. I don't worry too much about getting older. It's inevitable. He probably dwells on it a little bit more.
Packing back. Packing up.
Well, this is not because you're packing up. This is not age-related.
Right. So the neurosurgeons have replied saying they've looked at your imaging, the fractures are stable, they don't require any intervention, and they don't have any significant restriction on movement.
Phew.
So you are going to be admitted here under the care of the trauma team, so we'll organise a bed here. Okay. All right? But for now, as I say, we've got everything under control and we're happy.
Oh, awesome. All right, Timothy. I think when we get older, I think our dream is to get a camper van and drive through Europe. It's been such a long time since it was just the two of us. Hopefully we'll still like each other.
Are you coming up to the ward to see where he's going?
Yes.
Yeah, OK.
I don't want to get old and say, I should have done this, I should have done that. What I'm afraid of more is not the getting old, it's that you don't use your time wisely.
Well, I love the garden. I don't know how long I can do it for, but while I'm all right, I'm doing it. As long as I can see the sky and the flowers, I'll be quite happy.
I think I always held him in such high esteem that he was unbreakable. And I've seen that he's not, and that bad things can happen to him.
When I think back, I think I was actually really, really lucky to actually walk away. Probably taught me that I'm not as young as I think I am. Just got to be mindful that I've got Terry and the kids, and just enjoy my mountain biking more rather than try to push it and try and do crazy things.
I think of it sometimes when I'm sitting on my own. Been together all those years. I loved every bit of it. It was wonderful times. Wonderful.
I feel so much better. It's unbelievable. We're out every day. Really, this is the best I've felt for many a day. He is absolutely brilliant, considering the fact that he's the age he is. He is magic, really. And as time goes on, you become more important to each other. We're each other's carer.
Who was known as the Rocket Man in the 70s?
Rocket Man! David Bowie.
Elton John.
St George's. Major trauma, RTC. I've got a trauma coming in, high-speed RTC thrown 8 feet in the air.
He was driving a moped.
People are very vulnerable on bikes. The patient has very little protection. Anything can really happen.
He was hit by a car travelling about 80 miles an hour.
Thank you.